and ask you, probably if I ask anybody on the street, and I'll say, all right, you got arteries and veins, right? And I'll go, yeah. And so at any one time, half the blood should be in the arteries and half the blood should be in the veins, right? Yeah. No.
So I don't think that's right.
2/3 of the blood is actually on the venous side of your body at any one time. Isn't that weird?
I thought it was when we heard when she told us that last night.
Yeah. The reason is the liver, the bone marrow, the skin have large venous networks. So you've got more veins than you have arteries. And so, of course, you've got to have more blood to fill those up. So you have superficial veins that you don't have matching arteries for. So you've got, you've got arteries are deep. Arteries are always, except for these guys right here, which you can get to fairly easily.
Right.
So you have a radial artery and a radial vein.
Right.
An ulnar artery and an ulnar vein.
Okay.
But then, in addition to that, you have an antecubital vein, cephalic vein comes around, you have the median cubital vein, you have all these other veins that you don't have matching arteries for, all of these superficial veins. So when you're looking at somebody like me with no pigment, all of these blue lines, you don't have arteries next to these. These are all superficial veins. The deep veins are down here. So you have more veins than you have arteries. If you start exercising or you start to bleed, you can use what's called this venous reserve, that 2/3. Some of that blood can be shunted to the arterial side. And that half that blood is shunted by venoconstriction. That's what you were asking me about, the smooth muscles. Somebody was asking me about the smooth muscles and the walls of the veins. Those can constrict. And so blood is shunted to the arterial side. Or a better way to say it is blood flow is slowed so that it stays on the arterial side. The venous reserve is basically the amount of blood that's in the liver, the skin, and the veins of the lungs. So veins are referred to as capacitance vessels. Remember that arterioles are called resistance vessels because the arterioles have a large influence on blood pressure by constricting and dilating. So arterioles are resistance vessels. Veins are capacitance vessels because they can expand easily. They can store large volumes of blood under low pressure. They have the capacity to have this venous reserve. So they're called capacitance vessels. Venoconstriction basically slows blood flow into the venous side. The blood shifts, figuratively speaking, to the arterial side. Okay, I said this before. We were talking about, all right, blood flows because of pressure differences. Now, think back about diffusion. Substances move from an area of high concentration to an area of low concentration. Blood moves from an area of high pressure to an area of low pressure. All fluids, water moves from high pressure to low pressure. And so it's the pressure differences that move the blood. Now, for those of you that are mathematically minded, this says the flow of blood, or blood flow, is proportional to the pressure difference divided by the resistance. If the pressure, the greater the difference in pressure between two spots, high pressure, low pressure, the more blood is going to flow. If the pressure difference is 50 millimeters of mercury, as opposed to 10 millimeters of mercury, you're going to get flow. Because this is on the bottom, this means that this is inversely related to this. The higher the resistance, the lower the flow. Because if the denominator gets bigger, the whole number gets smaller. So, if you look at blood pressure in the aorta versus blood pressure in the vena cava. Now, remember that in the arterial side, because you have the pumping of the ventricles, that you get this fluctuation in blood pressure. Systolic, diastolic, systolic, diastolic. But even then, on the average, what happens is, as you move away from the heart, pressure drops. And so that's why blood moves that direction, because it's going from an area of high pressure to an area of low pressure. And of course, when we talk blood pressure, what we're talking about is the force of the blood against the arterial walls, or any blood vessel wall. But we detect it, we can feel it when we check our pulse, because that's that blood hitting those artery walls every time the ventricles contract. So, about 120 diastolic, about 20 in the capillaries, a little bit less in the vena cava, and practically 0 in the right atrium. It's not less than 0, but it's almost 0. Again, you want the pressure in the right atrium to be as low as possible, because it literally almost sucks the blood into there. The pumping action of the left ventricle basically creates the high pressure, and so that forces it to go to the other side of the heart, which is the low pressure. Okay, total peripheral resistance. 3 things that affect how blood flows. 3 things that can impede blood flow. So vascular resistance, blood viscosity, which is basically how thick the blood is, and blood turbulence, which is how roughly the blood is flowing. All right, vascular resistance is the big thing. Of these 3 factors, vascular resistance, under normal healthy conditions, vascular resistance is the major player in impeding blood flow. Now, vascular resistance is basically the friction that's created between the blood flowing through the blood vessel and the inside wall of the blood vessel, the tunica intima, the tunica interna, the endothelium, whatever you want to call it. And so, the longer the vessel and the more narrow the vessel, the more friction, the more resistance. The less blood that's going to flow through. Because if resistance goes up, blood flow goes down. Now, day to day, we can't change how long our blood vessels are. As we gain weight, we have to make more blood vessels. And this is one of the most depressing things I've heard. For every pound of fat, it takes 200 miles of blood vessels to supply blood to that pound of fat, to all of those little adipose cells. And that's why obesity causes high blood pressure, because your heart is having to work harder to get the blood through all those extra blood vessels. So when you say, I only lost a pound, celebrate. Probably water, but celebrate.
It's probably water.
But we can change vessel diameter. That's what our cell, or what our blood vessels do moment by moment, second by second, to make sure that blood flow is going to where we need it. And particularly the arterioles are the ones that can have the most impact on blood pressure and blood flow. So, smaller the vessel gets, the smooth muscles constrict, decreases flow, increases pressure. Smooth muscles relax, blood vessel gets bigger, blood flow increases, blood pressure decreases. Now, blood viscosity, you don't want your blood to be too thick. You don't want your blood to be as thick as ketchup. Because the thicker the blood is, the harder the heart has to work to pump it. You don't want your blood too thin, but you don't want it too thick. Hematocrit. Anybody know what your normal hematocrit is?
It's around 40.
Huh?
It's around 40.
Around 40, right. Men's a little higher than women. Yeah. So less than half of your blood volume should be made up of cells. If your blood if you get too many cells or too much protein in your blood, it gets too thin. So polycythemia is a disease where the person's bone marrow is producing too many red cells. You know what they do for these people? They do therapeutic phlebotomy. People that have polycythemia, it's called polycythemia vera, but they basically have to go every so often and donate units of blood to thin their blood down. You have certain cancers that can cause your body to make too much protein, and so the actual plasma of the blood is too thick. Either way, you know, blood viscosity. Normally, blood viscosity is not an issue. It's only in unusual conditions that it's a problem. And then turbulence is just like the rapids in a river. Remember, I kept saying that the endocardium was continuous with the endothelium of the blood vessels. You didn't want a speed bump. This is why. You don't want that blood to swirl. You want it to have smooth, laminar flow from the heart into the blood vessels. So anything like a blood clot or a damaged blood vessel wall or plaque can cause the blood to swirl, can cause the turbulence to increase, and that, of course, impedes blood flow. Day to day, it's the arterioles that control your total peripheral resistance because they control diameter of their diameter. If the arterioles dilated, those smooth muscles relax, resistance decreases, blood pressure decreases, and blood flow increases. If they constrict, if the arterioles get smaller, resistance increases, pressure inside that arteriole increases, but blood flow decreases. Less blood is flowing through there per second. What controls the smooth muscles in the arterioles? Those smooth muscles have to get signals. They have to know whether they want to relax or they want to contract. So those are controlled by the vasomotor center in the brain. The medulla oblongata. So you nuclei. Remember, in this case, nucleus means a group of cell bodies, right? A group of neuron cell bodies. These are part of the autonomic nervous system. And so those neurons would start right there. Their little cell bodies would be right there in the medulla oblongata. And of course, they would send their axons down and out through the sympathetic, out through the autonomic nervous system, sympathetic and parasympathetic. All right, we know about arterial blood pressure having basically two. You have the systolic pressure and the diastolic pressure. Basically, as the left ventricle contracts, that produces the systolic. As it relaxes, that produces the diastolic pressure. Pulse pressure is systolic minus diastolic. So if you have the normal blood pressure of 170, whoa, 110 over 70, then the pulse pressure would be what? 40, yeah, no higher math here. Venous pressure is very, very low. In fact, by the time you get to the vena cava, it's almost zero. And it's the fact that you're moving from high pressure to low pressure, that's why the blood flows. And you want the pressure here to be low. If anything makes this pressure go up, then it's going to impede blood flow. And so one of the things that the cardiovascular system controls is what's known as venous return. And basically, that's how much blood is coming back to the right atrium every minute. The right atrium is about zero. The venules, remember the venules is right out of the capillaries. So your pressure here in the venules is about 18 millimeters of mercury. And even though that's not a huge difference, 18 back to zero, that is enough to kind of draw that blood, almost like a vacuum, back to the right atrium. Now, if you look at several things here, you've got vessel diameter, how fast the blood is flowing, and the average blood pressure. We know that blood pressure drops from the arterial side to the venous side. That makes sense. Now, what happens is the blood's coming out of the heart, it's flowing very quickly, and then the further it gets from the heart, it slows down, which is good because here in the capillaries, we don't want it flowing too fast. We want to allow gas exchange, nutrient exchange to occur in those capillaries. And then as it gets out of the capillaries going back to the heart, the speed, blood flow, picks back up again. And the reason it picks back up is because of this up here. The vessel diameter on the venous side is bigger than it is on the arterial side. And so one of the things we talk about, even though pressure is low, since the diameter of the vessel is great, much more blood can flow. Does that make sense? When we talked about arteries and veins, we said that a lot of times the vein is going to have a bigger diameter than its corresponding artery, even though the pressure is lower and the tunica media is thinner in the vein. Okay, anything that causes the blood to back up, if you had a malfunction of the tricuspid valve when the right ventricle contracted, you rarely have this, but if blood regurgitated back into the right atrium, that would impede venous return. Now, two other things that help get the blood back to the heart. Muscular compression and the respiratory pump. We talked about muscular compression. We talked about the valves that were present, and particularly the limb veins, to help fight gravity. And so as the muscles of your legs contract as you walk, it literally helps to squeeze that blood back up to the right atrium. And even the diaphragm, as you inhale and exhale, they call it the respiratory pump. You're changing pressure as you inhale. The diaphragm, remember, relax the diaphragm's a dome. When you inhale, the diaphragm flattens out. So it decreases thoracic pressure, increases abdominal pressure. And when you exhale, the opposite happens. So that change in pressure helps compress and relax that, puts pressure on the vena cava, the inferior vena cava, to help push the blood back up.